In today's video tutorial, we will be looking at angina. Angina literally means the constriction of the chest. Angina occurs when the coronary arteries supplying the heart with blood narrow, thus decreasing the blood supply to the heart during times of excitation and exertion. An angina attack usually forces the patient to have the need to rest, thus allowing the pain to ease away, and over time the patient will be able to resume with their normal activities. For the recognition of angina, we usually ask the patient which region of their body the pain is in. Usually it will be in the central chest region, and it could spread to the jaw and down both arms. The patient may also experience tiredness, which would have come across very quickly and suddenly and unexpectedly. Also, the patient may experience a shortness of breath. Lastly, the patient may experience a feeling of anxiety. As a person possibly providing the first aid to the patient, our aim would be to reduce the strain on the person's heart and recommend that they take rest. We should also help them and advise them to take their medication if needs be. If we come across a patient with angina, there are 4 key steps that we should follow. Firstly, we should calm the patient. This involves stopping them from their activity, telling them to sit down and take a break, and breathe slowly. This will help them ease the pain and thus allowing them to recover from the angina attack. The second key step is providing medication. Patients with recurrent angina usually would have an angina spray of some sort or some tablets. As a first aider, we should recommend that they take their medication. However, if they are incapable of doing this, we should provide some sort of help, as this may really help them, may help ease the pain for them and prevent any further problems from occurring. The third key step is to recommend that the patient rests. Usually, the pain from angina will go away after a few minutes, and to speed this process up, we should recommend that any bystanders do move away, as this could further stress the patient, thus preventing the pain from dissipating quickly. For the fourth key point, we have 2 options. If the patient's pain does dissipate quite quickly and they feel as if they're back to normal, they can resume with their normal activities, but with caution. In case that the pain does not dissipate, and the patient is still feeling pain in the chest and even more regions after a few minutes, we should call 999. This is mainly because this condition of angina could worsen very quickly at times into other even more serious problems such as heart attack. In the case that the casualty loses consciousness, we should immediately check their airway and check their breathing. If they're not breathing, we should immediately start CPR. However, if they are breathing but not responding, we should follow the Dr. Hab process and put them into the recovery position and call 999 still. So in this video tutorial, we have come across the main steps that we should follow if we come across a patient with angina. For more first aid tutorials, please check the YouTube channel or visit the Medicaid website.